At his latest lecture in Coconut Creek, Dr. Julien shared UFE's benefits with gynecology residents and community gynecologists, highlighting patient success stories and the importance of preserving the uterus when possible.
It's obviously a definitive treatment for fibroids. You remove the uterus, you remove all the fibroids, but you are removing the female organ. A lot of women would rather keep their female parts. And it is major surgery done under general anesthesia in a hospital setting, which is gross, and a long recovery, and you can have complications. So you can understand why a woman would potentially want to avoid a hysterectomy. Now, there's some women who seem excited about getting a hysterectomy, but most of them are not. And there's a lot of women out there who want to maintain their fertility. A lot of times it's sort of vague and nebulous. You know, they might be 45, maybe they're single, and they might get in another relationship. They just want to have the possibility of being able to be fertile. And of course, a hysterectomy means you are not getting pregnant. So myomectomy can be done lots of different ways: open, hysteroscopic, laparoscopic, robotic. I think one of the challenges with myomectomy to be effective is you need to remove them all. And a lot of times there's numerous fibroids and they don't get them all. And a lot of times I'll just say this, the kind of ignore how many there are and take the 3 big ones and leave 15 little ones. And this is the way the math's done. It's like a big oak tree. If the big oak tree's cut down, the little oak trees, they grow really fast. So if you remove 3 big fibroids and you have 10 little ones, those little ones are going to grow pretty quickly. Sometimes I've seen cases that it looks like phantom surgery. Phantom surgery is when someone said they operated but they didn't. Well, it's like there's these huge fibroids that after they did a myomectomy, and that's because they're sucking up all the hormones. So you need to remove all of the myomas, otherwise you're going to have a recurrence. And there's also a lot of bleeding with the myomectomies. Now, fertility is preserved, but you guys can correct me, but I've been told that you're supposed to wait about 6 months before you get pregnant, and you should have a C-section. Okay, so those are some limitations that aren't really present with uterine embolization. So
later, he highlighted the advantages of uterine fibroid embolization, especially as a more women-friendly procedure for those who want to preserve their ability to have children.
Uterine artery embolization means you cut off the blood flow to an organ. We've done it all over the body for years for different reasons. If someone has trauma, you might embolize an artery from a pelvic fracture. If someone had a big kidney mass and you wanted to limit bleeding, you might embolize the kidney. And so it's a very well-known technique that's been around for many decades. And in the case of embolization, you enter the bloodstream either through the radial artery or the femoral artery. I prefer the femoral artery. You go into the internal iliacs, and then you use a microcatheter, like a little angel hair pasta or smaller type catheter, it's very soft and flexible, that gets into the uterine artery, and you inject these little calibrated particles, which is what our Terumo friends sell, in addition to the microcatheter. And you can see them here in this little cartoon. And so their size, they come in all different sizes, they're color-coded. So we usually use 600 microns, and you know that with the 600 microns, they're gonna go a certain distance in and give a very predictable amount of ischemia to the uterus. So we're intentionally making the uterus hypotensive and ischemic. Now, the fibroids, I think of them like weeds in your front yard. They're very wimpy. They all die. The fibroids die, but the uterus lives. We don't target individual fibroids. So whether you have 1, 50, or 100, they all die. And that's really the cool thing about it. It's done in the office. It used to be done more in the hospital. Hospital doesn't do a very good job because I'll see the pain protocol. They're not very good at following pain protocols. So we do it in the office. They go home a few hours later. They recover at home. 19 out of 20 go back to work in a week.
Dr. Julien presented a series of cases of women who found lasting relief through uterine fibroid embolization. He particularly highlighted one case that had an unexpected outcome.
There's a bunch of fibroids. There was like 30 or 40 fibroids in this lady. Some of them pretty big. This is about a 5.5 centimeter one. That's probably a 6 to 7 centimeter one over there in those 3 projections. So there's a lot of bulk. So this is the gadolinium enhanced sagittal. And that is 3 months out. So this is how it looks. These are all dead fibroids, those black holes. There's no flow. The fibroids are dead. And it was only a 28% volume reduction. Notice that, so it's October 29th. And so here's pre and post. You'll see it's smaller. So I actually called the lady yesterday because I was curious how, you know, it's still a lot of bulk there, but she was doing a lot better at 3 months. So she was very animated, very excited, and she's had even more improvement. And she was excited to tell me that she had to change her clothes because they were all getting smaller, and she went from a size 6 to a size 4.
Finally, he summarized the main advantages of UFE, with data showing that it is a better alternative for thousands of women seeking relief while preserving their uterus.
UAE is safe and effective. There's about a 50% reduction in fibroid size, 90% effective for both bleeding and bulk symptoms. It's about 80% effective for adenomyosis. A lot of ongoing studies. I kind of think of it as there's not a lot of options. I think it's worth trying before a hysterectomy. UAE doesn't preclude other treatments. If you're one of the 10% that doesn't get a good result, you can always have another procedure, hysterectomy even. We're doing a lot more staged procedures for those pedunculated or larger fibroids that are sticking out, or for large submucosal ones. Had really good results. I don't want to say any surgery is easy, but the gynecologists will routinely say that was pretty easy or pretty straightforward. So that's always nice to hear that you helped a colleague out. And lastly, I don't ever advertise UAE as a fertility treatment, but if someone wants to get pregnant but keep their uterus, has a bunch of fibroids, and we're trying to treat all these fibroid symptoms, I think this is a reasonable way to go. That's it.